actually expend a lot of energy, especially in their early, rapid growth period. They need foods specially formulated to meet their extra calorie, protein, vitamin, and mineral requirements. Puppy food, in other words. Almost any of the major commercial name brand foods will do, as long as they meet the Association of American Feed Control Officials, or AAFCO standards, and are substantiated through feeding trials. Many veterinarians and breeders, however, may still recommend a pet store or veterinary premium or prescription brands. These super premium foods may be slightly more costly than most of the commercially available brands, which may reflect their claims of higher caloric density and higher quality ingredients. But whichever food or foods you select, remember that many dogs like some variety in both taste and texture, so be prepared to cater a little. Also, don't get into the bad habit of feeding your puppy or dog too many people foods. Not only will these spoil him, they are usually not very healthy for him either. Now that you know what to feed your new dog, the next step is to determine how often those feedings should be. You want to try to feed young puppies, those under 4 months of age, 3 times a day. Now, twice a day is fine too if that's all you can do. Most puppies will go on eating twice daily throughout their entire lives. A few may start showing a preference for a single meal a day, but most veterinarians recommend twice daily feedings, especially for large breeds which are prone to gastric bloat and torsion. This is a potentially deadly condition where the stomach expands inside the abdomen and then twists on its axis. Very dangerous. By 1 year of age, most dogs are ready to switch to adult dog food, but some veterinarians recommend keeping larger breeds on puppy food for a little longer. Whenever you decide the time is right to switch to adult food, do it gradually over a few days. It will help your dog avoid problems like diarrhea. For AAFCO standards, most pet store, veterinary, and name brand commercial foods contain the nutrients your dog should need under normal growth conditions. There is a large variety of vitamins and minerals available to supplement your pet's diet should you or your veterinarian feel that supplementation would be indicated, such as with dogs recovering from surgery or other stressful situations, or older dogs who are suffering from arthritis or degenerative conditions. Always consult with your veterinarian regarding supplementation. Here's a subject that stirs up considerable debate: to chew or not to chew. Some fear that giving their puppies chew toys sets a bad precedent, but the fact is that all dogs need to chew, especially puppies. Regular chewing helps them get rid of their baby teeth at the right time and helps keep their permanent teeth properly aligned. So the question is whether or not they should chew, but what they should chew. There are numerous products on the market today that are both safe and satisfying. For instance, nylon and plastic polymer bones are sturdy, and since your dog won't be able to break off chunks, extremely safe. Hard-packed rubber toys and thick rope toys are equally as safe. For the same reason, chew sticks made of pressed rawhide chips are relatively risk-free as well. Bones and chew sticks made of sheet rawhide, on the other hand, can unravel as they're softened by your dog's saliva, allowing him to detach and possibly choke on large chunks. Soft rubber playthings pose a similar hazard. That doesn't mean they should be banned from your home, but you should observe a few precautions with these products. If you can, remove the plastic noisemaker from the soft, squeaky toys. If they're swallowed, they can cause major intestinal problems. Unlike with nylon or plastic polymer toys, don't allow your puppy or dog too much unattended playtime with soft rubber products or bones and sticks made of sheet rawhide. At the earliest sign of wear, dispose of these toys and buy something new. There are a number of steps you can take to help ensure a long and healthy life for your pet. The right toys, the right food, and please, sensible portions. Obesity is the #1 nutritional disease affecting dogs and can lead to a number of serious health problems. You may think you're doing your pet a favor by giving him frequent treats or table scraps. What you're actually doing is setting the stage for trouble down the road. Since individual animals' metabolisms vary so much, you'll need to adjust your pet's ration according to his or her individual needs. A simple guide to follow is that you should be able to feel the rib cage and that your dog maintains an hourglass shape when viewed from up above. If your dog needs some calorie modification, there are many excellent diet foods available which are lower in calories and higher in fiber and caloric efficiency than regular foods. Since it's as hard for dogs to lose weight as it is for people, it's never too early to establish good eating habits. That means keeping fattening treats and table scraps to a minimum, and introducing your dog to the benefits of a regular exercise program, which we'll discuss at greater length in our next section. In the wild, animals rarely have to worry about exercise. Most of their waking hours are spent in pursuit of food, a process that burns up a lot of energy. But when the food supply is only as far away as the pantry, that's a horse or a dog of a totally different color. Exercise is extremely important to adult dogs and puppies alike and should be done on a daily basis. But be careful not to give your pet too much of a good thing. Puppies in particular need a certain amount of movement and physical stress for their bones and muscles to develop properly. But too much pounding on joints and skeletal structures can lead to long-term physical damage. That's especially true of those large breed dogs, which are highly susceptible to hip problems. Until they're at least 2 years of age, these dogs should only get moderate exercise with none of the persistent pounding they get while jogging on pavement or playing on other hard surfaces for long periods of time. Allow your dog to gradually work his way up to more vigorous exercise and check the pads of his feet frequently for signs of injury. 20 minutes of moderate exercise a day is ideal, whether it's chasing a frisbee or tennis ball in the park or taking a brisk walk together. In fact, it's not only a good workout for your dog, it's healthy for you too. Of course, you have to exercise common sense as well as muscles. Take suitable precautions if it's extremely hot or cold outside, and if you have an older dog or one with arthritis or other partially debilitating medical condition, consult with your veterinarian before starting your exercise plan. Also, when you're out there having fun, don't forget to clean up after your dog. This will help eliminate any zoonotic concerns you may have regarding you or your kids, and will confirm that you are a responsible pet guardian. Regular exercise, it's a good way to keep your dog fit, and just as important, it's a great way to have fun together. If your pet were suddenly sick or injured, you'd automatically take him to your local veterinarian or pet hospital. But veterinarians provide far more than just emergency care. Regularly scheduled, thorough medical examinations are key to maintaining the health and well-being of your pet. Not to mention a great way to strengthen the wonderful bond that you will develop with your new friend, as well as solidify the bond between the two of you and your veterinarian. Puppies need special attention, especially when they're quite young. Your veterinarian will examine him closely for existing or potential health problems and will start him on a series of vaccinations to help build his immune system. Just like new babies, your puppy needs these immunizations to protect him from deadly diseases. The first injection is only the foundation for developing protection, and the subsequent injections are the ones needed to build up a sufficient level of antibodies. This series usually takes place from 7 up to 20 weeks of age, and it is extremely important to complete it to ensure a healthy immune system and protection. Many puppies are born with parasites or worms as they are passed to them from their mothers. So be sure too, when bringing your puppy in for an exam, to bring along a stool sample so it can be checked for parasites. Do not use over-the-counter dewormers, as they may be dangerous to your pet's health or may be for parasites that your pet doesn't even have. Your veterinarian will check for the individual parasites and treat them with an appropriate, safe medication. During one of these early examinations, your veterinarian may recommend to implant your new friend with a microchip. It's a universally accepted method of permanent identification. A combination of the microchip and a standard external ID tag, something I highly recommend, will provide the best form of identification. If your dog is ever lost or stolen, this combination may be his only ticket home. I also strongly recommend purchasing pet health insurance for your new friend as a great way to be able to continually provide the best health care. Veterinary diagnostic and treatment modalities have improved greatly over the years, and many hospitals are now equipped with blood analyzers, ultrasound machines, endoscopes, and even laser machines. These modern advances allow us to provide the best care for your pets, but have increased the costs of the services that we can provide. Pet health insurance is a great way to offset the higher fees without sacrificing the best care possible. Many policies available even offer coverage for routine care, microchip identification, spay, neuter, and vaccinations. So make sure to speak with your veterinarian about pet insurance. Vaccines are needed not just to ensure the early health of your young pet, but also to help him maintain that high level of health and immunity as he grows and matures. Your dog should also get some regularly scheduled booster vaccinations as an adult. There are a number of diseases which dogs are routinely vaccinated against, but the vaccination and booster protocols vary depending on the disease prevalence in your area, your pet's lifestyle, and its own immune system. Many veterinarians are now giving certain boosters only once every 2 to 3 years, while others are evaluating blood titers to determine the need for any particular vaccine. Make sure to check with your veterinarian to find out what schedule he or she recommends. Whatever the recommended schedule, vaccines not only make good medical sense, in some cases, as with rabies, they're required by law. In most parts of the country where mosquitoes are a problem, your veterinarian will also want to check your dog with a blood test and begin preventive medication against heartworms. This is very important since a heartworm infection can be fatal if left undetected and untreated. Prevention is simple and ranges from an oral monthly medication to an injection which is good for 6 months. There are steps you can do at home to safeguard your dog's health too. One of the easiest but most important is maintaining a regular program of home dental care. Now I know the thought of brushing a canine's canines might seem funny at first, but when you stop to consider that the most common ailment affecting dogs over 3 years of age is gum disease, it's not really a laughing matter. Dental disease hurts. It can also shorten your pet's life by causing kidney, liver, and heart disease. There are toothbrushes available that have been specially designed to be used on dogs. The brush head sizes differ depending on the size of the animal and the condition of the gums. They are completely effective and extremely easy to use. Remember, never use human toothpaste on your dog. Use only gels that have been formulated specifically for dogs. Not only will your dog quickly get used to having his teeth brushed, I bet he'll soon begin looking forward to it, eagerly. 2 to 3 times a week, a few minutes each time, that's all it takes to help your dog avoid major dental problems throughout his life. Remember, doggy breath is not natural. It may be a sign of potentially dangerous periodontal disease. So have your pet's teeth and gums checked regularly. Here's another weapon all dog owners should have in their healthcare arsenal. Regular grooming helps your dog feel comfortable and look good, of course, but it's also an important part of controlling skin diseases and parasites like fleas, ticks, and lice. You'll find a lot of shampoos and flea control products on your supermarket shelves. I suggest you avoid these and instead have your veterinarian recommend effective skin and coat care formulations. Be sure to ask your veterinarian too about flea and tick control products for your pet, your home, and your yard that are reliable and safe. There are many excellent products available through your veterinarian, most of which require only a single monthly application, and some also provide additional protection against other parasites. I recommend against purchasing any flea or tick control products from a pet store, as many of these are of questionable safety and efficacy. Always check with your veterinarian. If you work with your veterinarian to practice preventive medicine, stopping problems before they start, you greatly increase the odds of your dog leading a happy, healthy life. Younger dogs should have routine physical exams at least once a year, and older dogs should be seen 2 to 3 times a year. Simple tests like blood and urine screens, x-rays, and electrocardiograms are a great way to assess your pet's health and detect problems before they may become serious or life-threatening. Spaying and neutering are important preventative procedures, but many people question if they're necessary.